When gram-negative bacteria like Neisseria meningitidis trigger sepsis, their endotoxins launch a full activation of the coagulation cascade that leads to DIC. The clots will form through the microvasculature and they consume platelets and fibrinogen, and also while red blood cells get shredded, not shredded like, but shredded because they're passing through, you'll start to see schistocytes on the smears, right? The prolonged PT and the PTT and also bleeding from the line. So like they'll say bleeding from the catheter placement or something like that, bleeding from wherever you're inserting the lines. And you'll have crashing blood pressure as well because you're bleeding all over the place. So in sick septic patients with oozing and shock, you should always see schistocytes because you're dealing with DIC, okay? So that's kind of all there is to it. Atypical lymphocytes, those are going to be seen with your viral infections like EBV. Remember, there's another video we talked about this. The T cells are the atypical ones, even though it affects the B cells, B19. Hal-Jo body is nuclear remnants of the red blood cells, asplenic cells for functional hyposplenism, hypersegmented neutrophils, those are megaloblastic and B12, and folate deficiency, and reactive thrombocytosis. That's going to be your infections. And this patient has your thrombocytopenia and bleeding, so it's the opposite. And here's our severe pancytopenia. That's aplastic anemia. Yeah, hypocellular marrow, and it's not part of DIC. So only the platelets and the fibrinogen drop acutely. Okay, hopefully this is helpful. If it was, like and subscribe for more content too.